we are going to do some simple stretches which will help the core muscles of the body. By core muscles, we mean the important group of muscles around the lower back, hip and pelvis complex. For this, we use a chair, a mat and a blanket. Lie on your back, rest the legs on the chair, keep an appropriate neck pad. Use of the chair in these postures is quite significant because the moment you lie down like this, your complete spinal column rests on the floor and the venous returns of the blood from the legs to the heart is much easier and comfortable because of the gravity. Now keep your left palm on the chest, right palm on the abdomen. Breathe consciously. As you inhale, the abdominal cavity should smoothly, gently all around expand, and as you exhale, it should contract. Chest should be stable. So the palms will give you the feedback about the movements. The right palm should move synchronously with the breath. The left palm should be stable. As you exhale, you have to contract the abdominal muscles. This hollowing the abdomen is important, and this will help in activating the transversus abdominis muscle, which is very crucial in the health of the lower back. And as you breathe like this, you should feel the movement not only in the front but also in the back and the sides. So the complete abdominal cavity should expand with inhalation and contact with exhalation. Feel the movement of the diaphragm and feel the massaging effect of breathing on the intestinal muscles and organs. So you must learn to breathe this way. Also try to make the exhalation little slower than the inhalation. Retaining this type of breathing while doing all the postures is very important. Now fold your right leg, hold the knee, press the knee towards the chest, stretch the heel. Raise your right leg, check, left leg. This posture is very useful to begin the day, because this will mobilize the gluteal minimus and medius muscles, the hip muscles, and also helps the back. Release the left leg. Repeat. Right leg. You have to press the knee closer to the chest. Breathe consciously. This also helps in nicely massaging the intestinal organs. Chair. Stay for about 15 to 20 seconds with good conscious breathing. Now relax the left leg. Next one, fold your right leg across the left thigh. Take the heel as close to the root of the thigh as possible. Then push the right knee slightly towards the chair. Watch your breathing. This simple movement will help the sacroiliac joint, that is the articulation between the spinal column and the hip bone, that is the pectoral girdle. Release the right leg, chain. This also helps the knee joint. Release left leg. Repeat. Right leg. The core muscles around the lumbar, pelvis and hip, they connect the lower extremities and the upper extremities. So it's very important to keep them healthy. Chain. important to breathe consciously. Relax the left leg. Now we do one more simple stretch to activate the back of the thigh, the hamstring muscle and the calf muscle. Raise your right leg, pull the kneecap, stretch the heel, tighten the thigh muscles. This is a very simple stretch that activates the leg and the thigh muscles, and they also help the hip and the lower back. Down. Left leg. Stretch the heel, pull the kneecap. This is very important to stretch the heel. If you stretch the heel, the Achilles tendon and the gastrocnemius muscle get a stretch, and that will further reinforce the stretch on the hamstring muscles, which will help the health of the back. Down. Repeat. Right leg. Chair. In all these things, you must breathe consciously. The diaphragmo-abdominal breathing is very important. Down. Now one more stretch we do for the gluteus maximus muscle, which is one of the major muscles of the body. For this right leg up, fold from left hand, hold the right ankle, pull, stretch the heel from right hand, press the knee slightly across the abdomen. You have to pull from the left hand, push from the right hand. Breathe consciously. Now you feel the stretch on your right hip, and that is the gluteus maximus muscle. Release the right leg. Chair. Fold left leg. From right hand, hold the ankle joint, stretch the heel, pull from left hand, push the knee across the abdomen. So this is also a very effective stretch for the hip and the back. Release the left leg, repeat. All these sequence of postures are very important towards the health of the back. Chair. Now release the left leg. Now we do one more posture, especially for the deeper muscles of the hip, because the core muscles actually consists of some of the stabilizing muscles in and around the lumbar area, which includes the abdominal cavity and pelvis cavity and the hip. Fold your right leg and rest the ankle just on the thigh, closer to the knee. Stretch the heel. Now move the left leg. Hold. Stretch the heel, then push the right knee. Now release the left leg, relax the right, chair. Pull left leg, pull the right leg, keep the heel active, then push the left knee. Relax the legs. Repeat. Push the right knee. Feel the stretch deep in the region of the hip socket. Relax and then chain. Pull the right thigh, push the left knee, when you inhale and exhale, you must feel the massaging effect of breathing on the muscles of the lower back the abdomen and the intestinal organs. Relax the legs. Now we are going to do a simple stretch which will enhance the massaging effect of breathing, especially on the lower back, the posterior region of the lower back. Hold both the legs, stretch the heel, hold the knee, press the knee towards the chest. Because of the pressure of the thigh on the abdomen, you will feel an enhanced massaging effect of breathing on the thick skin or the thick fascia covering the lower back. That is called as the thoracolumbar fascia, and that is very important in the health of the lower back. It is often referred to as the nature's back belt. Not only in these postures, in all the postures that we did in this sequence, you must feel the effect of breathing on the thoracolumbar fascia, that is the thick tissue covering the lower back. Good conscious breathing is very important in all these. Now relax the legs. And then slowly get up from the right side. Now we are going to do some simple stretches for the lower extremities, especially the foot, ankle, calf and the thigh. We use a chair. First one, fold the toes inward, join the heel and the big toe. Keep the knee closer, chest and navel up. Hold the chair. The foot should be nearly perpendicular from the base of the metatarsals to the heel. So once you get the balance, then you can fold the palm in salutation. So this is very useful for the toes and also the intricate muscles and ligaments of the foot. Foot is an amazing part of our system. It helps in all our locomotion, standing, running, everything. Now just relax the foot. Repeat. Raise the heel up. Hip should be on the heel. Chest and navel up. Initially you can start with holding the chair. Once you are comfortable with the balance and stability, you can fold the palm in salutation. Stay for about 15 to 20 seconds and slowly come down. If you are comfortable with both the foot, you can attempt the following. Go on your toes, take the right leg up, keep the right ankle on the left thigh closer to the knee, stretch the heel and balance. So this will further help you to activate the intricate muscles and joints of the foot. If you find balance, fold in salutation. Then slowly come down. Then change. On your right foot. Even if you can't do this, hold the chair and balance. That will help the foot to be more stable, more flexible. Slowly come down. Now we are going to do a good stretch for the calf muscles, which will also improve the range of motion at the ankle joint. For that we use a chair. Stand about 1 to 1.5 foot away from the chair. Flex the knee. Keep the right foot against the leg of the chair. Take your left leg about 2 feet away. Pull the kneecap on both the legs. Then push the hips closer to the chair. Raise the left heel. Pull the kneecap. Chest and navel up. Keep on pulling the kneecap. You should induce this stretch. And slowly come back. Chain. You have to flex the knee, that is the right knee, butt the left foot against the leg of the chair. So initially, if that is difficult, you can reduce the inclination, but with practice you can take the foot flat against the leg of the chair, pull the kneecap, rise the right heel, push the hip closer to the chair. Now you feel the stretch in the leg. It's your gastrocnemius muscle, the soleus. They all get a good stretch. Incidentally, this is also good for the knee joint and the ankle joint. This is the so-called the dorsiflexion of the ankle. Repeat. Right foot against the leg of the chair, then raise the heel, push the hips. This will help the kinetic chain of the lower extremity. When you do this, the Achilles tendon is a major tendon of the heel. That gets a good stretch, which further induces a stretch in the gastrocnemius muscle, which also helps the hamstrings to get well activated. Slowly come back and chain. Left leg. Pull the kneecap, rise your right heel up. Chest and navel up. It's very important to pull the kneecap. Push the hips closer to the chair. Slowly come back. Once you are comfortable with this, the same stretch can be further improvised in the following way. Flex the left knee, butt the right foot against the leg of the chair. Keep the right leg straight. Keep the left foot on the chair, chest and navel up. The gastrocnemius muscle or the calf muscle is referred to as the second heart of the body because it plays an important role in the venous returns of the blood from the lower extremity to the heart. So keeping this muscle healthy is very important. Stay for about 20 to 30 seconds and you must consciously watch the muscles that are active in this posture. Slowly come down. And while doing all these postures, you must also breathe consciously. You must be aware of that slow, steady breathing. Keep the left leg straight. Take the right foot on the chair, chest and navel up. Pull the kneecap. As we inhale, the abdominal cavity should smoothly, gently expand. As we exhale, it should contract. Slowly come down. Now we come to the muscles of the thigh. One of the major muscles in the thigh is the hamstring muscle. A group of muscles called the hamstring muscle. At the back of the thigh. Stand about 2 feet away. Stand upright. Note the orientation of the foot with reference to the chair. Stand upright, raise your right leg up, rest the heel on the chair. Now this is very important. You must stretch the heel, toes towards the knee, pull the kneecap, tighten the thigh muscles, push the root of the right thigh down, lift the trunk up, then gradually lean forward, hold the chair. Chest and navel up. Right leg absolutely straight. Keep on stretching the trunk up and also push the right thigh down. This induces a good stretch for the back of the thigh, the hamstring muscles and also the gluteal muscles, that are the hip muscles. Slowly come back, chain, left leg up, stretch the heel, pull the kneecap, tighten the thigh muscles, chest and navel up, slowly lean forward. Keep on pulling the kneecap. Breathe consciously. Have a good presence of mind. Then the postures become meditative. Slowly come back. Repeat. Right leg up, stretch the heel, pull the kneecap, push the thigh down, lift the navel and chest up, back. So if you release this, the stretch is gone. You must keep the legs active, trunk stretched up, so that a good stretch is induced. The hamstring muscles play an important role in the health of the back. The spine sits on the muscles and bones of the hip. The sacroiliac joint, that's where the spine and the pectoral rim is connected, and that has a good connection with the hamstring muscle. So hamstring muscles help a lot in the health of the spine. Slowly come back, chain. Pull the kneecap, stretch the heel, chest and navel up, and slowly lean forward. Muscles depend a lot on the kinetic chain. The muscles do not act in isolation. They act as a group. So doing all this stretch will help the complete lower extremity and also helps the spinal column. So the foot is connected to the knee, knee is connected to the hip, hip to the back, and back to the upper extremities. So it is very important to look at the stretching in a holistic, complete or comprehensive manner. slowly come back. If you want to further increase the stretch for the hamstrings, you can go about 12 inches away, then repeat. Right leg up, stretch the heel, pull the kneecap, chest and navel up, gradually lean forward, hold the chair, pull the kneecap. So by increasing the distance, you can intensify the stretch on the hamstring muscle. Breathe consciously. Slowly come back. Chain. Chest and navel up. Slowly lean forward. Pull the kneecap. Try to look up. Slowly come back. Alternatively, you can also increase the height at which you keep the leg. If you are comfortable with this height, you can graduate to the next level. For example, one can keep a blanket here, one or two, and keep the legs on them, or you can also, if comfortable, try to use the top of the chair. Stand about a foot away, stand in Tadasana, but in all these ensure that the orientation of the foot on the floor does not change or deviate. Right leg up, stretch the heel, pull the kneecap, push the thigh down, chest and navel up, then gradually lean forward. Hold the top of the chair, look up. So this provides a good stretch for the thigh and the leg. And very important to stretch the heel. Toes towards the knee, pull the kneecap, tighten the thigh muscles, push the right thigh down, lift the trunk and navel up. Breathe consciously. Slowly come down. Chain. Pull the kneecap, stretch the heel, push the root of the left thigh down and look up. Slowly come down. Now we do a side stretch which helps the so-called adductor and abductor group of muscles, gives a good stretch. Stand the chair to your right side, stand upright, stretch your right leg, on the chair. Stretch the heel, pull the kneecap, push the thigh down, lift the trunk and navel up. Hip is a ball and socket type of joint with a very wide range of movements. So it's very important to induce a good stretch for all the muscles which help in this wide range of movements. Slowly come down and change side. Pull the kneecap, stretch the heel, don't turn the pelvic rim. So that's why you should grip and turn. Chest and navel up. Hip is a very stable and highly mobile joint, which is very important in all our major activities. Come down. So it's a joint which gets into lot of loading when we stand, walk, run, etc. Once you are comfortable with this height, again the height can be increased by keeping some blankets here, or if the range of motion permits, one can use the top of the chair. But all these things have to be done in a graded way. So stand upright, pull the kneecap, then rise your right leg up, stretch the heel, pull the kneecap, push the thigh down, grip this and turn. So the pelvis orientation is well maintained. Slowly come down, then chain. Keep on pulling the kneecap, stretch the heel. The orientation of the right foot is also important. Pay attention to the breathing. Slowly come back. Hip is perhaps a very versatile joint, and we need to also look at the ability of the hip in taking the leg back. That you should stand with the chair behind, adjust the distance appropriately, rise your right leg up, stretch the right leg on the chair, right leg straight, chest and navel up. Turn the hip properly and keep the right leg straight. Slowly come back. So by doing all these movements, we are trying to give all possible movements for the hip. The flexion, extension and the sideward movement. Rise your left leg up, pull the kneecap, stretch the spine up, orient the pelvic rim. The pelvic rim will have a tendency to rotate. You should prevent that so that the hip socket and the muscles around that becomes active. Come down. Chain. Hip will initially have a tendency to rotate the pelvic rim. So you should turn that and then keep the right leg straight. Chain. Left leg up, left leg straight. Keep the pelvis in balance. Then down.